Hello everyone. Welcome to Lify Life. Erection problems, how stress, overwork and endocrine disruptions affect a man's intimate life. Erection problems can appear at any age, including young men. How to help your partner. Erectile dysfunction is a serious problem for many men. For the stronger sex, this is not just a physiological disorder, but a situation that makes you feel anger, shame and fear. It is important for a woman to understand that the lack of a sexual life is not only stressful for her, but also a great psychological burden for her partner. Therefore, it is important to know how impotence develops, what to do and how to help your man. A family medicine doctor talks about why men have erection problems and how to treat erectile dysfunction. What is erectile dysfunction in men? Erectile dysfunction, obsoletely called impotence, is one of the two most common sexual dysfunctions in men, besides premature ejaculation. Erectile dysfunction is defined by the World Health Organization, WHO, as the persistent or recurring inability to achieve or maintain an erection during intercourse. But it is important to know that there are many definitions of such a problem. It all depends on the severity and symptoms. Remember that a man may occasionally experience erection problems, and this does not have to be a wake-up call. Having an honest conversation with your partner will keep you from distancing yourself from each other and, if treatment is needed, will increase your chances of recovery. Why do erection problems occur? The impossibility of a full-fledged sexual intercourse is influenced by many factors. Moreover, more than 20% of all cases of erectile dysfunction are provoked by psychogenic causes. Stress, problems at work, failures in personal or professional life, fatigue and overwork, complexes and low self-esteem, previous failures in sexual intercourse, traumatic experiences associated with sex, fear of fertilization of a partner, inappropriate ideas about sex, for example, that sex is a sin, unsatisfied sexual preferences, conflicts with a partner or distrust, loss of physical attraction to a partner. Lifestyle can also affect the quality of an erection. The reason lies mainly in the use of stimulants, cigarettes, alcohol, drugs, but also in lack of physical activity, malnutrition and excess body fat. In addition, some diseases are also causes of lack of erection. Hormonal disorders, e.g., testosterone deficiency, thyroid disease, diabetes and its complications, cardiovascular diseases, including arterial hypertension and atherosclerosis, too high cholesterol in the blood, neurological diseases, for example, multiple sclerosis, damage to the blood vessels and nerves responsible for erection. Erectile dysfunction can be a harbinger of other diseases of the body. Often, impotence is the first sign that should not be taken lightly. If the disorder develops relatively slowly, there is a decrease or complete absence of nighttime, morning, spontaneous erections or a loss of erection during intercourse. This may indicate a disease of organs and even individual systems. In the case of psychological factors in the development of impotence, this disorder is usually associated with a sudden loss of sexual activity. What methods can be used to treat erectile dysfunction? First, it should be noted that any treatment should be selected individually for a particular patient. To do this, you need to collect an anamnesis and undergo the necessary studies. There are several treatment options for erection problems in men. Methods are selected on the basis of research, depending on the cause of the problem. One of them is pharmacotherapy, that is drug treatment. These can be preparations containing testosterone, phosphodiesterase inhibitors, or synthetic analogs of natural prostaglandin, which are injected directly into the penis. Another treatment option that is practiced quite frequently and with good success is psychotherapy. Indeed, in many cases, The problem with achieving an erection lies in the psyche. The problem is exacerbated by the fact that many men view sex as a field for testing themselves and demonstrating their masculinity. In such a situation, any failures in bed can lead to a vicious circle. Frustration will intensify and more prevent the achievement of an erection. It is assumed that such problems can be corrected with the help of psychotherapy. In this regard, in particular, cognitive behavioral therapy is used, the effectiveness of which has been confirmed by numerous studies. Its purpose is to break down mental barriers that prevent or may prevent proper erection. In addition to psychological methods of problem solving, a psychotherapist may recommend relaxation methods, changes in diet and lifestyle, and increased physical activity. Unfortunately, studies have shown that only about 5% of men with erectile dysfunction opt for any treatment. The reason for this is often ignorance of the fact that such an intimate problem can be solved with the right therapeutic approach. It is here that a woman should play a key role. Do not be shy to talk with a partner, be interested in his problems, consult doctors, read medical articles. How should a woman respond to her partner's erection problems? If the problem occurs periodically, you should not focus on this and even more so put pressure on the man. Instead, you should be understanding and supportive, such as offering a relaxing bath, watching a good movie, or having a glass of wine. For many men, the time when such an intimate problem arises is a moment of great emotional and psychological sensitivity. Of course, as you might guess, few men admit this, which is why partner support is so important. If a woman suspects that her partner has erectile dysfunction, every attempt at sex ends in failure, you should offer your man a visit to a specialist. You should talk about this carefully and restrainedly, without reproaches, reminding you that you are one team and that there will always be support. It is best to visit a psychologist, sexologist or urologist. These specialists have the most knowledge about the diagnosis and treatment of erectile dysfunction. When a man cannot satisfy his woman, this does not mean that he has another, with whom he has already been fed up. Often there is a real problem that the partner cannot and is afraid to talk about, so here the woman should not stand aside. Thank you for watching. Make sure you like the video and subscribe for our new content. Click the bell sign to stay in contact with updates from us. Hope seeing you back on Lify Life.